How
Hi.
are you?
Good, great.
You're doing real good. You passed.
Yes.
Welcome to the other side. Welcome to the other side.
Yes.
So, what course were you in?
I was in June
You were
course.
in June. So
Yeah.
it wasn't that far, about 6 weeks or so, give or take. Yeah. And so, how many questions were you?
80.
80. Wow. You knew your stuff then.
Oh yes, I was way over prepared.
That's what we do, right? We over prepare our students so that way you walk in there and you feel so confident. So, was this your first time, or have you taken the exam before?
No, that was my second attempt.
So yeah, so we've got anywhere from people that go from 75 to 145 first time. And I'm not exaggerating. I've had somebody that was like 14, 15 to time. So I've got all types of things, all types of test attempts. So Asya, what is your advice for people on the other side?
Well, before before I go into advice, Dr. Z, I just wanted to thank you again. It's funny because I took the exam on Monday, but my results were on hold for pretty much 48 hours. So imagine me 48 hours going insane.
Wow.
And on a Wednesday, I found out I passed. Although I kind of like walked out of the testing center knowing I passed. But again, it's always that feeling, what if I didn't?
Of course.
So I'm very thankful to you. You were there,
Great.
you were supportive. Nurse Claudia, she is just amazing. I worked with her one-on-one.
Okay.
Took maybe about 5 or 6 one-on-ones with her, and we just literally like went over everything, like even little stuff. So I appreciate you. Thank you.
You're
I'm
very
glad I
welcome.
ran into you, and I wouldn't be able to do it without you for
Well, you're
sure.
very welcome. I'm so proud of you. So now
And
what is your advice?
advice would be to listen to your lectures, definitely, over and over and over again. Even if you think you know the topic, still just listen. And everything that you say is golden. Everything. And guys, when Dr. Z says, Dr. Z says, the question could be asked in this way or that way, it will definitely be asked that way. So make sure you know that. Do whatever works for you, but content is golden. Like, you have to know it. And if you like, sometimes I wasn't able to do 440s, so I would do like 75 and 75. So do whatever works for you. Everybody's schedule is different, but definitely go over the content, listen and listen and listen. And of course, there's help that you can reach out and
Get the
work with others.
tutors. Yeah.
Yeah.
Yeah, I always think the best combination for students is a combination. The courses, you can't get around the course. It's content. It's getting in the mind of what I'm going to do here in a little bit, of showing you how the board's going to ask, how to approach it again. And so it is. There's no getting around it. It's not an easy exam. There's no trick to it. I didn't say, oh, look at, try this and do that. I'm like, hey, look, you just got to work hard, right? So.
And definitely use the method, because there will be questions that you don't know what this is. I got a couple of them. I was like, what? I never went over this. But if you use the method, you can easily eliminate answers and just kind of like, for me, I would just choose the safest option. I had a couple of medications. I had no idea, like no ending, like nothing. It's just like, I'm like, what is it? I don't even know what is this for, but just selecting the safest option that would be safe for the patient. I think I got them.
But yeah, well, clearly you did. So
right.
Asya, congrats. Thank you again for joining us.